and welcome back to my channel, Mental Health with Melissa. I'm Melissa. I'm a licensed clinical therapist, an LCSW social worker in particular, and I am a clinical supervisor and a PhD psychology research student. Today, before we get started, please don't forget to hit that like and subscribe button for more content like this. I post new videos every single Wednesday and Sunday on information about mental health for those that are interested in the mental health professions, and also mental health information for our communities of color to break down that stigma even more so. It is June, so that means that it is Pride Month, so happy Pride, everybody. Hopefully we're celebrating and enjoying love. Pride Month should be celebrated every single month, and I just wanted to kind of throw that in there. So I hope that you are enjoying your special Pride Month of love. Today, we are going to be continuing on the journey of the categories on LCSW exam series. So the last video that I posted was kind of an elaboration on each of the categories on the LCSW exam. And somebody commented and requested that I go into more specific questions on the LCSW exam based on the categories. So what I'm going to be doing for the categories on LCSW exam series is every video I'm going to be coming up with a new practice exam question from a different category. So there's a few categories. I'm going to link down that video below so you know what I'm talking about. But today we are going to be focusing on the category professional relationships, values, and ethics. And this particular question is going to be more specifically about scope of practice. So scope of practice can actually go under ethics and values. The professional relationships, I may have another question for that at another time, but if we're looking at this whole category in itself, we are going to be looking more particularly at ethics and values. Now, depending on what state you are getting your licensing exam, if you're getting your licensing exam done in California, then you have to do the law and ethics exam in California. Now, although there's a specific exam for that, there are still ethics questions on the LCSW exam. So we're going to explore one of those questions today. We're going to break it down. So let's go ahead and get to it. So let's go ahead and get started with breaking down the question as we normally do. I'm going to post some of my other videos from the past about breaking down questions. So this one is no different. We want to look at the actual question and break it down before we go into the options for the answers. So a social worker meets with a new client who was referred for issues of depression and anxiety. During the assessment, the social worker discovers the client has a long history of obsessive thoughts and compulsive behaviors. The social worker has never worked with clients with OCD, but thinks it is an area she could be interested in learning more about. What must the social worker do? Okay, so now that I've read out the question, because I know some people are more auditory learners, so I like to be able to read that out loud before we break down the question. And if you're more of a visual learner, then please take a moment to pause the video and read the question yourself. Please also take a moment right here to pause this video so that you can look over the options of answers and choose what you think is the best answer, so that when we start to break them down later on in this video, you can compare your rationale and answer to what my rationale is for each of the options and what the actual correct answer is. So, the social worker meets with a new client. Okay, so this is a new client, and we're going to go over why it's important to kind of figure out what part the client is in the therapeutic process. Okay, so this is going to be possibly helpful information. Who was referred for issues? So the primary issues are for depression and anxiety. However, upon further assessment, the social worker discovers the client has a long-standing history of obsessive thoughts and compulsive behaviors. So the social worker has never worked with clients with OCD. but she's still interested in this area and wants to learn more about it. So what is she going to do? Okay, so let's go ahead and take a look at the options. Option A, treat the client, consulting relevant literature, and receiving consultation as needed. Now, this is making an assumption here. So let's break down this question. Consulting relevant literature and receiving consultation as needed. Do we know if this social worker is even working with any other providers that can provide her consultation? We're not sure about that. And there's nowhere in this vignette that tells us that she is. So that's kind of a red flag right there. And treat the client. Now, this is also a red flag because, as I mentioned earlier, this is one of the questions that is specifically for scope of practice under professional relationships, values, and ethics. So would that be the right thing to do or the ethical thing to do, treating the client that has issues with something very specific that the social worker really has no experience in? That doesn't seem like that would be ethical. So just based on that, let's move on to option B. Option B, meet with the client for depression and anxiety issues and refer her to a separate therapist for obsessive compulsive disorder treatment. Okay, so meet with the client for depression and anxiety issues and then refer her to a separate therapist for obsessive compulsive disorder treatment. So this is interesting because it's saying that the client should still be treated for one thing and then be referred to another therapist for another thing. So that's kind of like a more complex type of response to this. But so before we say yay or nay to B, let's continue reading on so we can see if we can do the process of elimination and just see what our other options are. Okay, C, refer the client to someone with experience treating OCD. Okay, well, that's interesting. So up here, this one said to refer her, but to still continue to treat her. But this one says just refer her. Okay, let's read on and see what else. Wait to begin treatment with the client until the client obtains appropriate training in the treatment of OCD. Now, right away, this kind of seems like a red flag because if you're waiting to treat the client, then the client is just sitting with these symptoms and doesn't have any support if you're just putting this person on hold. So that would not be, well, let's think about this. Is that ethically appropriate to do? That doesn't sound like the right thing to do. So we can cross off D. We can cross off D and we can cross off A. So now going back to B and C. So again, B, meet with the client for depression and anxiety issues and refer her to a separate therapist for OCD treatment. Now, if we have been studying for the exam, then one of the things that we should know at this point is that it is not within the client's best interest to have multiple therapists. And the reason being is because the therapists that are involved may be telling the client conflicting things, and it may overall just confuse the client. So we really want to prevent having a client have multiple therapists, because again, this can be confusing for the client and also for the treatment plans, because if you're working simultaneously on similar or overlapping things, that can be very confusing. Now, I know that this social worker would see the client for depression and anxiety, and they would refer to another therapist for OCD treatment. But the thing is this is a new client. So we can safely assume that maybe some of the issues of the depression and anxiety are really coming from what is really extensive here in their history, which is the OCD. So we want to make sure that we're able to abide by that rule of thumb, in that a client should really be seeing one therapist. So because of that, this would not be appropriate. B. So C, refer the client to someone with experience treating OCD. Now, the reason why we choose this one as well is because this is a new client. So at this point in the game, remember earlier I mentioned we're going to come back to this part right here about where the client is in the therapeutic process. Now, this may be a little bit different if this client has been with you for a while and you've already developed a rapport. So you would definitely want to talk about where they're at in their treatment if they've been with you for a while, and what their thoughts would be about seeing somebody that specializes in something else. But because this was an initial assessment and the social worker discovered the client's longstanding history, at this point, the appropriate and ethical thing to do would refer the client to somebody who has experience treating OCD. So that's why C is going to be your best answer at this point, and you're going to choose C. Now, this is an interesting topic, because with initial assessments and being in the mental health and behavioral health fields, there are several types of therapeutic providers. So as a licensed clinical social worker, I'm able to do intake assessments, I'm able to do therapy with clients. However, if they require some sort of psychological testing, whether that be intelligence testing or testing for specific intellectual disabilities, that would be really out of scope for me as a licensed clinical social worker, and for a lot of licensed clinical social workers, because licensed clinical social workers, for a lot of us, are not trained in psychological testing. I mean, there may be a special subset, but really mainly psychologists do psychological testing and do intellectual testing, things of that nature. So the reason why I know this now more so is because, like I said, I'm in school getting my PhD in psychology right now. And so right now I'm in a specific class called psychometrics and appraisal testing. So this is a psychological testing course. Now, in this class, I'm learning a lot about psychological testing, and there's different levels of testing. There's level A, level B, and level C. Level A tests are tests that are really available to the public. So these are tests like self-screening tests. If you've gone to your primary care's office and your primary care gives you something to fill out about how you're feeling. So really anybody can do that, and then you give it back to your provider, and then they kind of go over the results with you. Level B testing is something that a lot of social workers or primary health providers are able to do, and they're able to score those. So they ask the questions and they score them, and then they go over it with you. Level C is more along the lines of psychological and intellectual testing. So those tests are usually completed by psychologists that have experience and understand these specific tests that are not widely available to the public. And so if we're taking this example, treating somebody with OCD, there are specific assessment tools that specialty therapists use for OCD. One of those is the Yale Brown. I don't know if you've heard of that. And then there's further levels that are used to screen and then ultimately treat OCD by the appropriate provider. Now, this part may just be a little bit extra for you. I know that I had already gone over this portion, but it's just interesting information that I'm learning in my program. And, it's always interesting to compare what I learned as a social worker and what I'm learning now as a psychology research student. So thank you so much for watching. Share down below in the comment section what category from the LCSW exam you would like me to do a practice question on for the next video, because I'd be happy to do that. Again, please don't forget to hit that like and subscribe button for more content like this. Until next time, you know the drill. Managing mental health matters.